Hello everyone, my name is Dr. Kok Soon. I'm a senior consultant at Orchard Heart Specialist Clinic. Now today I'm going to give you a general brief overview of all the general common heart conditions that we see daily in our clinical practice here. The first common conditions that we see almost on a daily basis here in our clinic are patients with hypertension. And when we say hypertension, what we meant is that normal blood pressure would usually, when you measure it, measures less than 140 over 90 millimeters of mercury. What that means is that when we check the blood pressure going through the arteries in your heart, the pressure when the heart is contracting, the systolic blood pressure should be less than 140 millimeters of mercury. Now when the heart is relaxed, and that's the diastolic blood pressure, and usually that should be less than 90 millimeters of mercury. When someone with a blood pressure more than or persistently more than 140 over 90, that indicates that the patient has hypertension. Although hypertension is a very common condition, we are still not quite sure why some people have higher blood pressure than others. In about 80-90% of patients with hypertension that comes through our door, there's really no specific reasons that we can point to. The second common heart conditions that we encounter in our clinics is that of arrhythmias. This is a condition or group of conditions whereby the heart is not beating regularly. Normally, it's quite easy for patients to suspect whether they have this condition or not because they are aware of their heart skipping beats or pumping very fast or irregularly. It's important when you have these symptoms to see a doctor or see a cardiologist for that matter to ensure that you do not have irregular heart rhythms that can affect the heart and cause other complications like heart failure, strokes, or drop in blood pressure. The next common heart conditions that we see is that of coronary artery disease. When we say coronary artery disease or ischemic heart disease, what we meant by that is that patients come to us with symptoms related to blockages in their heart arteries. The heart arteries that supply the heart are called coronary arteries, and that's why we term these general conditions as coronary artery disease. Now, there are a spectrum of severity in terms of patients with coronary artery disease. At one end, it will be so minor, the narrowing is so minor that you can just leave it be and you're not aware of it. At the other extreme, there may be certain blockages of the total occlusion or certain blockages of the heart arteries leading to acute heart attack or myocardial infarction. This is a common condition and it is eminently preventable and treatable. Okay? The common conditions that likely to cause blockages in the heart arteries are things like hypertension or high blood pressure, high cholesterol level or hyperlipidemia, diabetes mellitus, lifestyle activities like patients that smokes, that do not exercise too much, or possibly overweight.